Are you there? I can't hear you, Sam. If you might be muted.
She just now sent me the invite, so I just come over.
Okay, perfect.
Yeah, so I'm here. She's still assigning a lot of people.
Okay. So we have about, right now, there's about 19 people in the room, just so you know.
Okay, thank you.
And can you see my screen? Okay.
Yep,
Okay.
Perfectly. Thank you, Diane.
Mm-hmm.
While we're waiting, if I can understand who my audience is, Diane, can you can see the people in the room? Can you?
Yeah, let me, I think I can. Hold on.
Okay.
Right now it has hide names and I'm trying to find out how to unhide everything. I'm so new with the Zoom. I wish Chelsea were here. Okay, so we have Rhonda Huff is here. And maybe yeah, so we have Rhonda, we have Elena.
Diane, can they state what their position is in the company, please?
Sure, go ahead. And so when I say your name, if you could just give a little brief introduction of yourself. So we'll go up here and I'll start with Mary Fuller.
Hey, I'm the CNO and COO
Okay.
at Foster Primary Health.
And then we have Rebecca French.
I am the RN navigator for cardiology.
Okay, and then we have Rhonda Huff.
It's Hoff. It's a little easier than it sounds.
I'm sorry.
And that's okay. I'm the CEO at Neighborhood Health Services.
And then we have Elena Pumphrey.
Pumphrey. I am the director of clinic operations at Prosser Memorial Health.
Okay, perfect. Then we have Deb Watson.
I'm a clinical project manager at Pullman Regional Hospital.
And we have Ed Thornburg. And he looks like he's still muted. I think he's from Comprehensive. Ed, are you on? All right, we'll go to the next person. We have Haley Middleton.
Yeah, I'm the director of health at CBHA.
And we have Kendra Palmeras.
That's pretty good, Diane. Kendra Palmeras, Catholic Charities, the director of our Tri-Cities office.
We have Sarah Lear.
This is Ed. Can you hear me now?
Yeah, we can hear you, Ed.
Okay, I'm the program director for behavioral health with Astria Healthcare. Sorry about that.
That's okay. I couldn't remember where you were at now. And then, so now we have Sarah.
Yeah, hi. I'm the nurse navigator for Lourdes Primary Care Practices.
Okay, thank you. And Vicki.
Hi, I'm Chief Nursing Officer at Kittitas Valley Hospital in Ellensburg.
Okay, thank you. We have Yolanda. And then we have.
You might not have audio.
Okay.
He's from Catholic Charities, our grants and contracts controller.
Perfect, thank you. We have Cody Ecker. And Rhonda Holden.
I'm the Chief Ancillary Officer at Kittitas Valley Healthcare in Ellensburg.
All right, thank you. And then we have Victoria.
Hi, I'm a quality coordinator at Tri-Cities Community Health.
All right, great. And that's, I think, pretty much. And then we have Sulamita. She is with Greater Columbia Accountable Community Health as well.
Hi there, this is Berta. I joined late. Berta Lopez with Yakima Valley Memorial Hospital, Director of Community Health and Health Equity.
Thank you. And then if there's
as well from Comprehensive Healthcare, I'm the director of the Walla Walla site.
Okay, great, thank you. Is there anybody else that I may have missed?
Molly Calhoun, director of nursing for Catholic Clinics.
Okay, great, thank you.
Stacy George, Quality Manager at Community Health of Central Washington.
you.
And this is Richard Lee at Tri-City Community Health in Pasco.
Thank you. All right, I think that's everybody, Sam. So you're welcome to go ahead and go on to the next slide here for you.
Thank you. We have a lot of material to cover today, so if you have any questions, if you could put those into the chat box, and then Diane will guide that as we go through each one of these agenda items. We're going to start out with the revenue sharing model for cohort 1. This is a new model that will be starting January 1st, and it will be through December 31st, and it's in regards to the milestones, what the contractual agreement looks like, and then what we will be going over is how those payments look when you actually receive those. The next one is the budget that we will cover. So you can go next slide, please.
Is it the Excel spreadsheet that we're going to go through?
No, just go to the next slide.
Okay, perfect.
This is just the agenda items.
Okay,
so
perfect.
go to 7. In the budget development and reconciliation, the reconciliation would be your previous year for 2020, and we can talk about that briefly. Many of you have used the funding, overused the funding, which is great. That's what we want. And then also the development of the new budget that is due in February 15th for this revenue cycle that we'll be going through. Next slide, please.
Sorry.
So the proposed budget and the planned use of funding. So this is what we're going over is the budget first. Actually, let's do the revenue cycle. If you can go to the spreadsheet, let's do that first because they need to know how much money they have, right?
Yeah, so if I switch, could you see that now? Or do I need to switch the screen?
You'll need to, no, you'll go into.
I know, okay.
Okay, yeah.
I'm just making sure.
Okay, if you can pull it up just a little bit, please.
Zoom it in a little bit more, okay.
Yeah. Can everyone see it okay?
Oops. Sorry.
Yes, we can see it.
Okay, thank you. Okay.
Not letting me zoom it in. It's not letting me zoom it in anymore.
That's okay. I just need to pull it up just a little bit and then we'll go down to the bottom as we go through. That's fine as long as everybody can see it okay. So the first column is the milestones that we're going to briefly go through, and then you have a subset of columns that is the contract that are grouped together in your contract, but then how that relates to when you receive your payment is in the next columns. So you'll see that in 2021, you have your quarter 1, quarter 2, quarter 3, and quarter 4, and what the dates that entails for the payment. And then if you look to the right, it says 2021 potential based on the milestones, and this is what it would look like when it comes through the portal for payments. So this is what you would see from the CSI portal, the reporting portal that you get your information from. Now keep in mind for those that have organizations, those are all paid out of the executive portal, and those are clumped together. So for example, if you're looking at the budget, if you had 3 clinics, that would be 609 times 3 that you would receive. So you would know that that was in regards to the budget and the difference of how that looks. I understand that the executive portal has different descriptions, but we are developing the CSI portal for you to get this information and how it would look for payments. And please pay attention to the preface of the payments when I go through these, or the description of the payments, because this is what you're actually going to start receiving in via email form. And then you will also have access to go into the CSI reporting portal and be able to assess this at any point for you to be able to relate your payments, and for those that are tracking them to make sure that they're receiving all the funding and the milestones. So the first one is budget development. And there is no difference in the payments other than the reconciled budget, and the budget would be just called budget in general. So at the end of the year, you should have received, if you had achieved both milestones, $1,218. Okay, and the second subset of payments, can you, I can't go back down to where you were. I'm sorry. Okay. Care management, and that is how you're going to receive that description for these particular set of payments. Now, to understand that you will receive all of 2A1 to 4A2 that are in these particular columns here, it says $4,500, and that's how it relates over. And the new, and I love that the fact that the new, whenever you're looking at these particular ones, whenever you're looking at your contract, they're still laid out as individual, but this is what you're actually going to receive is the $4,500. And if you receive every single quarter, it's $18,000, but you will only, the description again is what I need you to pay attention to is the care management. Whenever you see that particular description that comes from the CSI portal in email format, or you log in to look at it, it entails all of these different milestone achievement. And this is not a all or none. It is a percentage. So if you, for example, if you're going to do 8 of these and you only achieve 6 of them, then that's the percentage of the payment that you will get is divided by, I think there's 9 total. 1, 2, 3, 4, 5, 6, 7. Well, 1, 2, 3. Yeah, there's 8 because those 2 are together. I mean 9. So you would receive that percentage of those divided by 100%. The next one is bidirectional, and there's no change there, and that description would not be changed. The next one after that is QI team. In the QI team, there is no change in how that would, the description. The next one is reporting. Reporting entails clinical quality metrics and MCO roster reporting. Those two will be combined together as a payment, and it will be under reporting. The next one is practice transformation implementation work plan, the PTIW. There is no change there, and the description is no change. The next one is care coordination. So it's a total payment of $2,217 total per quarter. It is all of these combined together. Now, if you pay attention for the clinics, there is 3 options for the clinics, and then for the hospital, there's 3 options. These are mandatory items that we will also discuss briefly as we go through this presentation. Next one is training and learning collaboratives. $2,738 per quarter. These are combined together. So you have 7A1 and 7A1 practice transformation learning plus the training and mentoring. And you will see training and learning collaborative is the only thing that, and I actually think it's just training is the description that comes across, but definitely the bolder items in the descriptions is what you really want to pay attention to. The next one is the HIT attestations, and there's no change there. Then the next one is the assessments, and there's 2 that are combined together, the patient-centered medical home, PCMHA, and the MEHAF. So if you do both of them within the same quarter, you will only receive a description of assessments for that $1,000 during the quarter that you did them together. Now, if you did them separately, then it's still going to have the description of assessments, but it would be paid at individual quarters of $500 each. Again, it's not a all or nothing. It is as you still achieve these individual milestones, but it's just a percentage paid out. So making sure that you understand the descriptions, what that entails underneath those particular milestones, and then that percentage if you did not achieve 100%. Is there any questions on that? Do you see any in the chat box? Diane?
No, there aren't any questions in the chat box right now.
Okay. We can go ahead and go back to the presentation, please. Keep in mind this number right here, $74,738 is what you're working with if you achieve 100% of all your milestones. And you're going to put that into your budget. Budget's due again on February the 15th. And that would be for this fiscal year of 2021. Okay. So this is a sample of what others have used for those that are new to this. I mean, many of you have been involved in this process, so you understand exactly how you can use your funding. But for those that are new, so these are the different areas in column left that we want to apply those funds for. So you would take your $74,000 and some odd change and make sure that you're calculating it into this budget to make 100% of that. Now that is not a set in stone budget. You can work with that and change it. It's a living document that you can update at any point in time throughout this contract year. So on the left is a new billing or electronic health record system. An example of that is population health management tool to upgrade to the current EHR system. There's many, many, many examples that we can give you. So if you have any questions on how you can use your funding, please don't hesitate to reach out. We'll definitely be able to assist you. Technical assistance, TA for population health management tool, or the template development, IT infrastructure, operating expenses for Q1 2019. They haven't updated that, so what it would be for 2021. So you'd look at your licensures for your EMR system, and office supplies, vehicle expenses, marketing, Zoom license, recruitment and retention of staff, so bonuses for recruitment, or definitely making sure, you know, that if your care coordination, if you need to recruit an RN, you know, a lot of them have bonuses that are associated with that, sign-on bonuses, improvements to provider network, so direct secure messaging, interoperability, like your phone systems for your 24-hour access, patient portals, and then staffing, new positions. You can use it for paid salary. Our recommendation is to make sure that you would look at sustainability for that particular position. So you could even forecast it for 2 years out. Quality improvement, time for QI meetings, time to conduct QI meetings. So those reporting, I know that takes a lot of time to be able to do practice transformation. So we want to make sure that you're paid for your time. So really recording those hours and giving that back to your department. Support to implement integrated clinical models, implementation of the AIMS model, co-location, the BRE, the pharmacist. So if you're implementing for example, if you're implementing a behavioral health therapist and they need an office, to be able to create that space in order for them to have an office or to be able to assess their patients, that isn't approved. The only thing that we ask is that you do not do a whole new remodel. So if you're moving into a new building and you're opening a whole new practice, then that would not be an approved expenditure for this particular project. But construction is definitely approved in order for you to be successful meeting these milestones. Staff to attend provider training meetings, that's a given, just to make sure that you're recording your time. And then other upgrades would to computer network, new exam tables, information monitors in the waiting room, and remodeling. Okay, are there any questions on that? Do you see any in the chat room?
Nope.
Okay, we'll go ahead and go to the next slide. And I do want to say that we'll have time at the end of this to also verbally ask questions and collaborate on what others have done in the past with their budgets. As you guys are coming up on your 3rd year, congratulations. So reconciled budget, if it is 15% over or under the proposed budget, the reason we ask if it's over, that you've spent all your money plus an additional over 15%, and we want to understand why. What have you done that, are we not giving enough funding? Are we not implementing it correctly? What do we need to do to make you more successful and be able to pay you for your time? So under 15% budget, it's not we're going to come and recollect the money from you. It is that you've already earned those funds, and how are you going to apply that to the next year? So if you overexpent one year and then underexpent the next year, and then you're going to apply it to the next funding, we want to make sure that we're using those funds to implement new projects or scaling up, those sorts of things, so that we can work with your navigator to make sure that you're actually using 100% of those funds. It is, we have
question.
Is that per each category or budget overall? It is only for budget overall. That was a good question. Thank you. Thank you, Deb. Okay, you can go ahead and welcome. Okay. Mandatory GCCM items. So this description is GCCM is for a Greater Columbia Cares model. We've been trying to really promote that because we do not have a prescriptive model of innovation for our milestones. So it really is innovative way for these clinics to take these funds and take these milestones and implement them for what works for their clinic and their organizations. So briefly touch on what is considered mandatory in our toolkit, and then we'll go through some examples of what that looks like. So MCO rosters was, and these all became effective in year 2. So I know that we're still working through some of those to make sure that we are meeting these milestones. And so by year 3, you guys are veterans to this, so we should be successful in meeting these mandatory items. So the second one is screening for social determinants of health, conducting a daily team-based huddle, and percentage of people screened based upon your selections. Follow up with patients after 1 no-show. Upload reports showing integration of bidirectional care. The MAT training, identification of a MAT referral or an opioid resource network, an ORN. Minimum required of 10% patients receiving self-management support. Upload reports showing the impact of self-management support based on the measures selected. Medication reconciliation. Engage pharmacists as part of the care team. Collaborative drug therapy management is mandatory for contracted or staff pharmacists. And please report the 3rd available appointment for the following appointment types: the acute visits, the adult well visits, the well child visits, and the new patient visits. Go to the next slide, please. So in each quarter, the sites will be expected to show an increase in the percentage of patients that receive surveys. We understand that during COVID, it has been really low volume, and we're starting to see an increase in volumes. And we understand that surveys are consistent across the board, that not being able to achieve increase at all different quarters. So we really are taking that into consideration. And whenever we have issues like that in any of these milestones, whenever that you incur issues, whether it's staff changeover or whether you're having to the resources to be able to implement these milestones, please, I beg you, I read everything that is in the reporting portal and I go through it with a fine-tooth comb. If you give me a realistic expectation of why you cannot meet that milestone, then you receive potential funding of either a percentage or whole percentage. So please make sure that you're utilizing those narrative sections. Then each quarter, the sites will be expected to show an increase in the percentage of patients that receive shared decision making. Please attest that your organization conducts internal quality improvement meetings. These meetings should occur without the practice transformation navigators. So even though that you have your practice transformation navigators that you have to meet with at least once monthly, then you also should be doing your quality improvement meetings outside of that as well. Review all CQMs for your entire practice site on a regular basis, so weekly or monthly. If you're doing it monthly, we ask that definitely, and it goes into a description in your workbook to make sure that you are sharing that information across the board with your organization. Upload a de-identified CQM, so your clinical quality metrics report for individual practitioner or care team. Meeting with practice transformation navigator at minimum once a month. Utilization of the collective medical, utilizing one health port. Again, one health port. I know that some entities don't find the information as important, but really truly just making sure that we're putting all pieces together of all the technology access that we have to make sure that we're getting the whole picture for our patients. So your feedback definitely is so important in those narratives. If you're not finding that this is really beneficial to your organization or your clinic, I want to hear about it. All three care coordination selections are mandatory. So again, this is split between the hospital and then the clinic system on what they need to do as follow-up. So if it's a clinic, follow-up contact within 1 week of the ED discharge, follow-up contact within 72 hours if it's a hospitalization, and then enact your care compacts. If it's a hospital, you're looking at identification of patients without primary care and making a referral. And then for identifications of patients that are in hospitalization without PCP and making a referral. So it's the same for the ED and for inpatient, and then also enacting those care compacts, collaborative agreements with your primary care and other resources that those patients might need. So next one. Okay. What was there one previous to this? Okay. Screening for social determinants of health. So these are true examples of what we're seeing from our practices. So you're looking at your risk stratification methodology, and this is what you'll see when you're doing your reporting is it says of the 95% of impaneled patients identified in 2A1, the target is to achieve risk stratification at least 85% of those impaneled patients. Patients that are risk stratified will be grouped into risk categories from low to high. And again, you guys are veterans at this, so we're seeing this across the board, and it looks really good. But also really implementing that mandatory part of social determinants of health and understanding how to get that information into that patient's chart, whether you're doing it at the front office or you're doing it at the assessment, when you're triaging your patient, to make sure that we're getting that into that whole clinical picture of how we really treat that patient and what resources they need, and do we have the availability to get them that resource. Okay. Next one. Reports. Everybody loves reports, right? There's always those quality reports we're looking at, but that's how we get paid. So uploading reports showing the impact of self-management support based on the measures selected. So if you're doing diabetes, then we want to see how many patients are actually receiving those self-management supports, and then how many patients are actually, the more information you can give us, if it's better for you to do it in the narrative, then we love seeing that as well. So if those patients are giving you success stories and it's working for them, or if you see that the majority of your patients are really just not implementing the self-management support and you want to let me know why your numbers are down, then definitely, please, I beg of you to make sure that you're giving more information. And because I read it. And I love looking at the success of these milestones or the barriers of these milestones. Upload a report showing integration of bidirectional care. And then upload de-identified clinical quality metrics report for individual practitioner or care team. And we're going to go through those examples now. Okay, and this is an example of the initial PAM. So looking at those social determinants of health and implementing those risk factors. So this is an expensive tool that many of you have not implemented, but it's just an example and will be greatly, please reach out to your navigator if you're having problems to be able to do this reporting, because there is a ton of examples and we can actually connect you with other clinics that are very similar in processes so that you're not reinventing the wheel. Okay, next one. So this is your clinical quality reporting, and this is an example of that. So this particular clinic has comprehensive diabetes. They're doing their depression screening, outpatient emergency department, outpatient, and this is 0 to 17, 18 plus patient experience. These are the pay for reporting and pay for performance metrics that we get paid for. So you really need to be able to assess your clinic and how you're doing within that particular clinic and how you can increase those measures across the board, because if we don't get paid, you don't get paid. And that's just the way that the MCOs and as well as the Medicaid program look at, and we are going into really implementing the higher percentage of payment coming from these clinical quality metrics. And not to be cumbersome for these clinics, it really drives these clinical quality metrics to look at whenever you're risk stratifying your patients, to be able to really crosswalk these different metrics to make sure that you're focusing on the ones that you need to improve in your clinics. Okay, next one. Just quality metrics, another example of that. And definitely being able to upload reports. We're trying to show you that there's different reports across the board that will be acceptable, and just making sure again that you're looking at your individual clinic and where you need to improve those quality metrics. Okay, next one. So pharmacist engagement. Engage pharmacists as part of the care team. Collaborative drug therapy management. We'll give some examples of those. That's the particular milestone when you're in the CSI reporting, what that looks like. Some of the questions, go back. So some of the questions, if yes, what conditions? And so that does not mean that you have to do all or none for all your different chronic conditions. You can actually pick one and those subset of patients and be able to report on them to be able to collaborate. That does not mean that you have to have a pharmacist that's embedded in your clinic. That just means that there's a collaborative agreement that's across the street at your local pharmacy. Or that you're engaging a pharmacist in part of that care team. So if there is medications, there's contradiction to the medication, or there's a question from the pharmacist why, this particular dosage, or just to make sure that that relationship and that collaborative agreement is there in place. Now, if you have a collaborative drug therapy management, that's a pharmacist on staff, then we want to make sure that we are working towards to make sure that they have the authority to be able to prescribe for that patient what might fit them better, but also to communicate that with the PCP or the physician that's prescribing to make sure that that works for that particular patient. So next one. MCO roster reporting. So to look at your MCO rosters, and I know that in the very beginning, we had some barriers to receiving those rosters, and then also that they were correct rosters. So if you're continuing to have that barrier, make sure that you're recording that or actually putting it into your narrative section. But from what I hear from the MCOs, there's no longer any barriers. Everybody's getting them. So just want to make sure that what we're hearing is actuality within these clinics. So this is exactly how you would report that. So AmeriGroup, this is an example in the reporting portal. Number of patients on the MCO roster was 422, but the number of patients in the EHR system is 253. Now there's a little bit more work to these MCO rosters. So you want to reach out to those patients that have not established care. If they are with another primary care, then we want to communicate to them that they need to go ahead and establish that particular PCP or that particular provider as their PCP. So it's no longer on your roster. And also to be able to communicate that back to your MCO organization. For those that have no primary care, to be able to be proactive in making sure that those patients get in and establish care. Okay, next one. Cohort 2 will be required to contract or have collaborative agreements with primary care. So for those of you that have a Cohort 2, for behavioral health, in the very beginning, we allowed them to be innovative and do any kind of integration, whether it's pharmacy or across the board. This also includes a referral, and again, we're not making this complicated, a referral or a collaborative agreement with a behavioral health therapist so that we can be able to refer them out. Just a contractual agreement that you will be able to make sure there's a resource available for that particular patient. It does not have to be one of these particular evidence-based models of breed, co-location, and aims. Okay, next one. Okay, and if you have any questions whatsoever, this is the navigators that you met before, and then as well as myself. And I have many of you reach out to me. If you have anything on the revenue sharing models, please definitely communicate with me. But if it's something in regards to your milestones, reach out to your navigator. And if you're not sure what navigator is really assigned to your clinic, then make sure that we are communicating that back to you. Yes, Deb, it will be available on the website as well as we will be sending it out. So if you need more than one of these presentations, definitely let us know what cohorts that we need to send them to. As you are aware, 1 and 3 are starting new years and new revenue sharing models. And again, the descriptions are in bold and what you would look at combined payments. So, and if you have any questions, definitely reach out to me. So at this point in time, I appreciate you guys listening to me. We'll go ahead and open it up for questions. Gosh, you guys are so quiet.
This is Deb. You answered mine, so thank you.
Perfect. You're welcome. I can say that I am receiving quite a few requests for yearly reports on the funding for 2020, just to associate them with milestones and so that they can go back and really look at what was paid and how that was associated. So if you need that particular detail and the payments that are associated, please reach out to me. I'll be happy to provide that for you. Isn't that right, Deb?
Very much so. And it was greatly appreciated. Thank you.
Welcome. Very welcome. Diane, do you have anything to share?
No, I think that this one went a lot smoother than I thought it was going to.
I know, me too. I thought there would be a lot more questions with the changeover in revenue, but of course, gosh,
They've
they've been
been
in this
doing it.
program.
Yeah.
Yeah, you guys have been in this program for a while, so you know the lay of the land. I can say that I'm very proud that the practice transformation has continued during this time of difficulty of this pandemic. So I appreciate you guys' really putting all the resources to continue that.
If anybody wants to go to if any of the others, you're welcome to, because I know that cohort 2 is they're just barely on the revenue slide. So if anybody needs to go to that one, they're welcome to go to that one.
This is Deb. I do have a question.
Uh-huh.
In the learning collaborative piece and the attending sessions, do you guys know what the educational sessions are going to be like? Is it still going to be like 4 or 5 that are mandatory, or are you going to add more to that? Or
no, it's still the same. Oh, go ahead.
I was gonna say we could. So we have actually planned out pretty much the rest of the year, and we can send that out to you guys. We have a schedule, so and we're trying to do them shorter learning collaboratives and more of this type of learning environment instead of having everybody in one room or we're going to try to do more breakout sessions and learn from each other this year. And then we have a couple, one that's going to be coming up is called Team Steps. And that's going to be on February, at the end of February, I believe it's February 21st. And they, Karen Hill, she was a presenter at the Opioid Summit as well as the Chronic Disease and Transitional Conference that we had. And she is going to be presenting, and that's going to be a really great one. But that one is about a 4-hour one. But we're trying to keep them no more than 4 hours, no more than half of a day, or 1 to 2 to 3 hours. We're trying to keep them shorter this year. And they're all going to be, most of them are going to be on a Friday afternoon or morning.
And the topics are on every single one of the mandatory items. So all of those mandatory items that we just discussed will be learning collaboratives as well. The other thing that I want to inform you is that all of these different milestones set these clinics up for at the highest level of primary care medical home certification. And so for those that are interested, what I propose for my budget, and we're currently in trying to align all of those different milestones and what that looks like. So if you are interested in certification, definitely reach out to your navigator, because they are there for that particular purpose as well. And I know that there's additional funding across the state, but however, we're trying to work with our MCOs in order for them, for those that achieve certification are already currently certified, that they receive additional dollars for certification. So, and then also that we are looking at funding or budgeting for to pay for that certification, that initial certification. So definitely reach out to your navigator. I know that primary care medical home has always been oh my gosh, that's just too much work. It's too much resources. It just costs too much. But you're really already doing the work. And again, being the veteran in cohort 1, I encourage you definitely to be able to achieve that certification and really work with your MCO to get that additional funding to support it.
thank you, Sam, for answering my question.
You're very welcome, Deb.
I have a question about the learning collaboratives. I think I brought this up last year around equity and health equity in particular. We know what's happening at the national level. We know that our patient population, particularly in our region, we have a large Hispanic population, certainly in Yakima, and certainly a big percentage of those patients are the patients that are our focus. So in the past, we've never had a learning collaborative that I know of or that I've attended related to health equity. And what are we doing about that? Because we know we operate in systems that contribute to disparities in health and that also tied to our social determinants of health. So I'm hoping that, you know, throughout our connections that we could have something really targeted to that end.
Diane, do you want to answer that? I know that we had one previously, and I think, I'm not quite sure, but I think it was more related to health literacy. But then also on top of that, we had some leadership council meetings. But if we are not addressing, this is what we actually request as a communication and what the needs and the resources are. And that's something that you need within your organization or across all organizations. We definitely will put that into the curriculum.
Yeah.
Sam, this is Rhonda. You know, I guess I'd also say that, you know, a lot of where the funding worked that you gave to the local lens were directed towards social determinants and health equity. Yeah, that's where a lot of our funds went.
Thank you, Rhonda. Yes, that's correct.
I was thinking more on the learning piece, right? Like how are we addressing systemic racism or structural racism within our organizations, institutions. I'll give you an example. At Yakima Valley Memorial, we are implementing Spanish discharge instructions. So we know that we have 38% of a population that's Spanish speaking. And so we've worked with our IT individuals and obviously with funds received from the practice transformation. We're working with our IT and they've developed templates so that we can now start doing discharge instructions in Spanish. So the documents that the patients leave with have education, follow-up information, and instructions about condition in Spanish. So, you know, in the past, we hadn't looked at it from a systemic systems level change perspective of how are our systems set up to really be equitable for all of our patients. And so now we're looking at it from a different lens. Same goes with, you know, how do we document that we provided interpretive services to our patients? And so we've developed mechanisms in our EMRs to document who we used as a qualified interpreter. So now we can track how many patients said that they need an interpreter and how many of those actually we documented that we provided an interpreter. So some of those kind of learning, I guess, strategies that we could share with other regional partners or even across our state.
Definitely. Diane and I will send out a poll and see how many organizations would like to be able to attend that. I know that also in the past that we have had funding available for specific education that was requested within individual organizations or clinics. So yes, definitely we hear you loud and clear, and we'll send out a poll and see how many people would like to attend that as well, or how many clinics. Okay.
Sam, this is Rhonda. You know, thinking about that, I was thinking about when we had Ken Crabel do the trauma-informed care session, and we've at Neighborhood, we have contracted with his organization to do a year-long session for all of our managers and on trauma-informed care. And actually in our next session, which is in next week, is specifically on, we did organizational culture, and the next week is on racial equity. They have a whole series, but it stemmed from the whole concept of trauma-informed care and how that affects not just individual care, but at the organizational level, and I think maybe at the systemic level as well. our approach is that if you start at the top and go with the managers, and then it really does, trickle to the individual interaction.
We can look into that. Yeah, that's
I hear what
definitely.
Bertha's saying too, but I think we have done some, but I could certainly appreciate that we need to do more as well.
Yeah, and I really like Ken Craybell's organization. They have a great setup the way that they have. So thank you for that information. We do have some funding in our budget for some more, specific learning opportunities. So we can look into that.
Yeah. And he has a
thank
whole
you.
network. The person he's bringing to do the racial equity is from Boston University, I think.
Okay.
And I'm looking forward to hearing her presentation next week with our managers.
That's great. And it's been really nice because we've been able to do a lot of these virtual, so they're not as quite as expensive as they have been in the past. So.
And the travel, yes, definitely. Oh, less time consuming. Rhonda, that's wonderful. Thank you for sharing that.
Yeah, it's been great so far. We've done 3 so far, and they're just better and better every month.
Oh, that's great.
Can you say the name again? Sorry, I didn't catch it and I wanted to write it down.
Well, the company is called C4, the letter C and the number 4 Innovations. And the principal, the person that I've interacted with the most, his name is Ken Crabill, and he's based out of Seattle, but his partners are all over the country. And like Diane or Sam just said, we're doing all of our trainings virtually, and so it's very affordable to have them do these trainings for us.
Yeah, Bertha, if you want me to send you that information, I can send that to you if you'd like. They also have they also provide a couple free ones every month. And so we do get that information, and we've been using it to in our newsletters, but I'll definitely send you their information, Bertha.
Thank you.
Diane, do you have any information you want to share? Or?
And we're also using our leadership councils as well for like learning opportunities and learning from each other too. And that's where like the lens, they do their present out about how the local health improvement networks are addressing the social determinants of health in their area. So we do have, those things happening at a higher level at the leadership councils as well.
In addition to that, we also are trying to align our leadership council so that whatever feedback we hear from the public, that we're aligning that with our education, our learning curriculum, so that we're really implementing what we're hearing and what the needs are in the resources that are needed within our communities.
We're also launching a campaign called Cope Calm Care. It's our resilience campaign that's going to be coming out. And after it's presented to the board next week, we will be launching that. So watch for more information on that. And that also is going to be in English and in Spanish. So watch for those billboards and the commercials that are going to be coming out. They're all over the whole county, the whole 9 regions so we're really excited about that campaign that's coming out. And I think that's pretty much all I have. Does anybody have any other questions or concerns? I think we could adjourn early today if you guys would like to, have half an hour of your time back. But I think we're pretty much done with our presentation, and we will get these presentations to you after the Learning Collaborative. Chelsea will be sending those out.
I think Chelsea wanted us to go back into the room and.
Okay. Sure. I'll tell Chelsea we're ready to come back in.
Okay, thank you.
So Diane, this is Lauren. I did a little bit of testing, and if everyone clicks on that leave room button in the bottom right-hand corner, two buttons will come up, either leave meeting or leave breakout room. And if you click on leave breakout room, it will take you back into the main meeting.
The main one. Okay.
Yep.
Thank you.
Mm-hmm.
I can't figure out how to get back in.
So do you see that leave room button on the bottom right-hand corner, Diane? It's blue.
I don't.
Of your screen.
I don't have it. Here. Oh,
maybe
it's
it's
right
'cause you're
there.
the
I see it. I see it. Okay. Got
Okay.
it. Thank you.
Welcome back, everybody. It looks like we're still waiting on cohort 2. It'll just be a few more minutes. Hey, Brittany.
Yes.
I still see some folks in cohort 3. Do I need to help bring them back to the main session, or were they still wrapping up?
I think they may have left their computer when we let them go for a break.
Oh, gotcha.
But we may
Okay.
need
So
to just, is there a way you can just close the breakout room and have them all come back?
Yes, I'll do that when Martine's wrapped up. I can close them all at the same time. So I think Martine's almost done, and then we'll be able, I'll shuffle them all back in the next few minutes.
Thank you.
Thanks,
Thank
Chelsea.
you. All right, we should be getting everyone back to the main room here in the next 45 seconds. Okay, I think we're all back, Sam and Diane, if you want to go ahead and take over.
Deb, did you want to go ahead and wrap it up for us?
Actually, I want to ask how everyone liked the breakout rooms, if that was beneficial for them or more productive, I know that it was a lot of information to cover and very different information to cover. So I'd like to have some feedback on that, please.
This is Teresa Adkis. I'm from Triumph. I just wanted to say I liked it because it was nice to have all the information just apply to the cohort that I'm in. So it was really relevant and it wasn't kind of a bouncing back and forth between like, well, if you're year one or year.
Thank you. Diane, do you want to read some of those in the chat box?
Sure. So it said that, let's see here. Hold on. Try to go up a little bit. That it worked really well for them. The slides were excellent and they allowed plenty of time for them to ask questions. And the Holly Kaiser said she appreciated the information. It was applicable to the cohort specifically, and Laurel did a great job to review the information. They said that it was good information.
I would like to share one. Go ahead.
Thank you.
I would like to share one bit of information. There is a request for a learning collaborative. Rhonda Hoff, if you're still on, can you please share that information?
Well, Bertha brought up the comment about having more learning around the topic of racial equity or health equity. And I was sharing that last year, some of you may have participated in the trauma-informed care presentation that was done by Ken Crabel. And he's a partner in an organization called C4 Innovations. And I've worked with him in different realms for several years, but his group is actually all over the country, and with all things virtual, it's very it works very well for us. But our organization has engaged him to do management training for a year. Every month we have a session for our managers, and we started with self-care in the world of COVID. We've done organizational culture, and this month the topic is on diversity, equity, and inclusion. And the presenters are all over the country, and our presenter this month is on is from Boston University, and the topic is racial equity. And there's a whole list, but it's been very affordable because all of our topics are virtual. So Diane has, I think, the information, and she's offered to send it out. They also have podcasts. We didn't talk about that, but they have podcasts that go out. A lot of them are free. I think Diane said that there are presentations online that occasionally are free as well. And so if that's something you're interested in, you should check with Diane about that.
Yes, and we have all that information. And so what we're going to do at the Leadership Council next week, we are going to ask for topics of like things that people want to learn about, and that could include the learning collaboratives. Like I said, we do have a little bit of funding that we could put together some kind of other special learning things like we have in the past, like when we brought Allison Masari, and Ken Crable has come a couple times and talked about self-care, and he's also come and talked about some of the he did the trauma-informed care. So yeah, we definitely have opportunities to do that. So it'd be good to know what people really want. And Berta, she's from Virginia Mason Memorial there in Yakima, and she was the one who had asked about the equity, and so that's when Rhonda brought up the Ken Crable again. So I can reach out to him, and if anybody wants their information, I have that as well.
Hi there. I am wondering if you help with alcohol outpatient treatment.
We have a lot of so our cohort 2 has some substance use providers.
So Monday and Tuesday at 11:30.
Sorry, but I think she's not talking to me.
Okay, and
I muted her.
Thank you.
Sorry.
I'm
I was
like,
wondering the same thing.
I was like, well, I could get you to Triumph, or I could get you.
TGIF. Sam, Diane, I just threw up the information or the dates for our next Leadership Council and Learning Collaborative.
Thank you.
Thank you, Chelsea. Chelsea, can you go through the questions that are on the chat, please?
I don't think there's any questions. Everybody just said their thank you. It was great.
Yes, the slides. I see one question about the slides. That we will be sending these out following the convening, and you should be able to find those on our website as well on GCACH.org, and they will be uploaded to the CSI portal. So plenty of different places to find them, but you should be receiving them directly in the next couple days.
And if there's no further questions, and Diane, Carol, Chelsea, if you don't have anything else to add, we'll give them approximately about 8 minutes back of their time.
Thank you, everybody. We'll see you at the next Learning Collaborative.
Thank you.
Thank you.
Nice job, guys.
Good job. See you next time.